This is Focus on Your Health. It's brought to you by Kingman Regional Medical Center in historic Kingman, Arizona. I'm TG LaFredo, and this week I'm coming to you from the Spine and Sports Injury Clinic, or SSI Clinic. My guest is Dr. Kathern Auer. She is a physician here. Hey, Dr. Auer, welcome.
Hi, how are you?
I'm doing well. How are you?
I'm good.
You're a little reluctant to do this whole radio thing.
A little bit.
Well, to make it more comfortable, we have set up in the coldest room in the building. And I'm directly beneath the air conditioning. It's fantastic.
It is.
We're in a little... Radio doesn't have to be pretty, right?
Right.
So we're in a storage room because it's quiet, but it's kind of like a meat locker in here.
You know, we could have waited till like August, late August to do this, and it would have been so nice in here.
It would have felt great.
Yeah.
I may have to go for treatment after hypothermia treatment after we get out.
Well, you know, this room used to be the quiet room for the emotionally overwrought patients in the emergency department, or the psych patients.
Oh.
And so earlier we locked ourselves in here.
That explains everything.
Yeah, exactly.
I did not know. Okay, well so where to begin? We are at the SSI Clinic, which is at the Wallapai Mountain campus, and I think a fair amount of listeners would know that, you know, this hospital was previously a different hospital, right? A different company came and built a hospital in Kingman and said, we'll show you. And then like a year or two later, they were out of business. KRMC bought this facility, and now this is your home base where you practice medicine. I get it, right? So you're set up in what used to be the ER.
Correct.
And this is the quiet room.
Right.
Which is why we got locked in.
Yeah.
Okay, well, that explains it all. But you hear that, right? So now I know that when I'm in this building, I'm recording in the quiet room.
Right,
This
exactly.
is the place to go.
Exactly.
All right. So that's fun and silly. But the SSI Clinic and sports medicine, and that's I'm interested in all this. A little while ago, I talked with Dr. Frank Sinopoli. He is, of course, a chiropractor who practices here as well.
Right.
The first chiropractor at KRMC that I've ever heard of.
Yes.
Right.
Yeah.
And you are a doctor, and let's start with that. Who are you guys seeing here for the Spine and Sports Injury Clinic?
So we're seeing patients of all ages, really. Anyone from, I think the youngest patient I've seen has been maybe 10 or 11, and the oldest patients I see are in their 80s.
Yeah.
And we see people for all kinds of musculoskeletal care problems. Basically, that's our main focus right now, is musculoskeletal health.
Okay.
We kind of have the philosophy that there's we call it the Spine and Sports Injury Clinic, but we do see a lot of spine, so we do take care of a lot of spine health issues. And we like to have a focus on the sports medicine as well. But we kind of feel like everybody has an athlete inside of them. Everyone does. And whether your chosen activity is gardening or, I don't know, taking care of your grandkids, or if you're a nationally ranked mountain bike racer, everybody wants to do something, and everybody wants to do it well, and everybody wants to do it comfortably. And so if we can get you back to where you were before, or help you achieve that level of activity, that's what we're here to do.
Are you managing a lot of long-term chronic pain, or is it acute, or is it kind of a mix of both?
So it's more the acute population of patients. However, what I do see is a lot of people who have been suffering with back pain or joint pain for a long time, who just haven't gotten a comprehensive either musculoskeletal examination, or they just haven't gotten comprehensive care to include all of the modalities and options that we have to take care of folks. And so a lot of times people will come in complaining of things that have been bothering them for years. And maybe they went to a doctor one time and they were told to take some ibuprofen and things would get better, and it just kind of never did, and they never went back because everyone's busy and your life interrupts. And so they end up coming to us because we're something new, so they think we'll give it a try. And then we can open up a bunch of options for people that they didn't realize that maybe they had before. They're reluctant to talk to their primary cares about it, or maybe they've been seen in the emergency department a few times and that didn't really work for them. And so we do end up seeing quite a few patients that have been having some long-term issues that we can kind of get them rolling, get the ball rolling on what they need to do to clear it up. But definitely we see the acute patient, sort of like the guy that just fell in the garage over the weekend and hurt his back or hurt his knee. That's what we're here for. But certainly I would not ever turn anyone away who has chronic problems. Now, it's more difficult to manage someone who has chronic problems, who's tried all the conservative treatments and really nothing's working. We don't have a lot to offer those patients other than maybe getting them to a surgeon or something like that. We do work really closely with pain management. So if it ends up being a chronic pain management issue that nothing else is working and we need to go to pain management, then we can get them set up with pain management. So we try not to turn people away just because their issue is chronic. We may not have a lot to offer, but it's worth a shot to come in and see us.
Yeah. With the chronic patients, I suppose, you were saying sometimes life gets in the way and you just have to kind of deal with that pain that's been nagging at you. And maybe for some of them, is it a case where they just figure that it's kind of a life sentence? So I've got this thing with my back and that's it. I'm stuck with it.
I think some people think that, but I think pain is one of those things that even if it's not acutely in the front of your brain, that you have it or it's bothering you, it sort of wears on you after a while. And I think it just kind of beats down your defenses sometimes. And I think it makes people they kind of just are willing to give up or settle with what they've got. Yeah. And not everyone is going to get better. Not everyone is going to be cured, or not everyone are we going to be able to make their pain go away completely. But I think there's a lot of people out there that we can do things for that's going to make them feel better or make their pain at least manageable, so it's not interrupting their lives. And if I can't do that, then I certainly will try to get them to the people who can do that. We don't do narcotic management through SSI. If it's an acute injury, you may be given a very brief prescription for some pain medicine, but most acute pain syndromes or problems or injuries, they can be handled with non-narcotic pain medication. So I am not a huge fan of narcotics for the acute injury. I think that a lot of people get started on them, and that's where you have a lot of problems.
That's scary, right?
It is. Yeah. And we see what's happening in our country right now, and it's sad, and it's frustrating. And it's sad and frustrating for me as a physician, for the patient, those patients who do get in trouble with those medicines, because I think, so many times it didn't have to happen. But nevertheless, I think that they serve a purpose. I think that in the right patient managed appropriately, they can be life-saving medications. But again, those patients need to be managed by a pain management specialist, and we don't manage chronic pain at the SSI, but we can get you to that person.
So I know that you have that pipeline to pain management and also to orthopedics here at KRMC. Is that right?
That's right. We sort of work together in the sense that, let's say you fell down and you hurt your arm, but you didn't break anything, and you were seen in the emergency department, and they discharge you home, and they say, follow up with the orthopedic doctors to get this checked to make sure everything's okay. Those patients will be evaluated, their charts, by the orthopedic surgeons when they call to make a follow-up appointment. And if the orthopedic surgeons think that it's something that can be managed conservatively and non-surgically, they're most likely going to refer you to us. And we're going to manage those injuries. If I find something after you've been seen in the emergency department that maybe wasn't expected and maybe it could be a surgical problem at some point, then I'm going to refer you back to the orthopedic surgeons. And we have a really tight close process for that, so that we're not losing patients to follow up. And patients aren't waiting 3 or 4 months to get in to see the orthopods when they can get in to see us within a day or two.
Yeah, I was just thinking that. I know that with all due respect to our friends over at orthopedics, they're always swamped. They have a lot of people, and we have an older population with a fair amount of orthopedic needs. And it can be tough to get in there and see them. Whereas my understanding with this clinic is it was put together with the idea that it's sort of like urgent care for movement, something like that.
Yeah.
Right?
Yeah.
And you
that's
can
a good way to
probably
describe it.
get in to see us, get in to see you in that day or the next day or something like that.
Typically. I don't keep any appointments per se open during the day for walk-in patients. However, if you walk in, the staff is going to ask me if I will see you. Yeah. And if there's nothing else precluding that from happening, then we're going to work you into the schedule. Now, you might have to sit in the waiting room for a little bit and wait, or we'll have you come back the next day. But right now, my schedule is the way it is so that I can see walk-in patients as well as scheduled patients. And we really haven't had a problem with that yet that I'm aware of.
Yeah.
And the front office is really good about coming back and saying, hey, somebody just walked in with a really sore knee, can you see him? Or sore neck, can you see him? Right. And we will. If we can, we absolutely will. It is my intention, and it is the intention of the people who are helping to manage this clinic, is that you will never have to wait more than 24 hours to be seen unless it's a weekend.
It's time for a quick break on Focus on Your Health. We'll be back in a moment for more with Dr. Kathern Auer. Stick around. Support for the Arizona Community Radio Network is provided by Kingman Regional Medical Center. KRMC invites you to volunteer at the Joan and Diana Hospice Home. Read to patients, help in the kitchen, tend to the garden. You can make a difference in your community, and it might just change your life. For more information, call 928-692-4680. And welcome back to Focus on Your Health. I'm TG LaFredo, and this week my guest is Dr. Kathern Auer of the Spine and Sports Injury Clinic at KRMC. You see athletes here, and you shared your philosophy that everyone's an athlete in one way or another. And I wonder about, if I may ask, about your background in sports medicine, why it interests you and what brought you here.
Sure. So I came here after graduating from medical school, and I initially started out in family practice. I did a year of family practice residency, and before I went to medical school, I should say, I did some volunteer EMT work in Las Vegas, where I was born and raised, and I worked for about 5 years, I guess, as an ER tech in a level 1 trauma center in Las Vegas, an emergency department.
Wow.
So had a big emergency medicine background to begin with.
Yeah.
And they were starting an emergency medicine residency here. And I thought, boy, I really think that's what I want to do. I really think so. So I switched residencies. But before I went to medical school, my undergrad degree was in athletic training. And I got my undergrad degree at UNLV. And so that was always interesting to me. And then as an adult, I swam in junior high school and played softball for years in Las Vegas on City League. And after I was out of high school and as an adult, I did a lot of triathlons and did some, bicycle riding and things like that. So I was more of the post-high school adult sort of athlete. And those two things fit really well together, emergency medicine and athletics athletic training. So athletic trainers, I think of them as like the paramedics for athletes. Yeah. And that was always nice about emergency medicine is, we're the first people that see all of these musculoskeletal injuries. We see a tremendous amount of patients with back pain. So that kind of a background really is conducive to sports medicine. Now, I tell people this because I don't ever want to be accused of sort of trying to be something I'm not. I am not residency trained in sports medicine, and I'm not even fellowship trained in sports medicine. But what I am is an osteopathic physician, which my training in osteopathic medicine is tremendous amount of hands-on, and it's all about how the musculoskeletal system works and how your musculoskeletal system is integral to your health, and how if that musculoskeletal system is not working right, you're not going to achieve optimal health. And so my background in manipulative therapy as an osteopath, and my athletic training background, and my background as an adult athlete, and my background as a board-certified emergency medicine physician, I think makes me sort of uniquely suited to manage musculoskeletal injuries and sports injuries.
By the way, you say triathlete as though it's no big deal.
Well,
it's a big deal.
It was just a lot of fun. I got into it because I was actually I was always a swimmer.
Yeah.
I was always a very good swimmer.
Yeah.
And I got into it, I was sort of shamed into it by my 50-something-year-old father-in-law who was doing triathlons. Yeah. And I thought, you know what? If that guy can do it, I could probably do it.
I'll show him.
So I started training with a swimming coach for triathlons. And I did a bunch of ocean triathlons in California, and I just fell in love with it. And the part that was, for me, was great. And I always used to say this to my father-in-law, I hated running. I'm not built to run. I hate running. And I always thought, if you could do anything else in a triathlon, like swim, bike, bake a pie, swim, bike, knit a sweater, I'd probably be a world champion. Yeah. But that running thing just killed me. So what I really realized was that I fell in love with open water swimming. And I really did like biking as well. So 2 out of 3, that ain't bad. It's not. Right? It's not bad.
Now, do you have these are all sports for independent, like solitary athlete, right? Out there training on her own early morning. That's what I picture, right? My sister is one of these. She's crazy. She's awesome. And she could shame me into,
Yeah.
Anyway. I picture that. Do you have an interest in team sports as well?
So it's funny you say that because my husband is a triathlete, and he's an Ironman triathlete.
Wow.
And he and I have very different philosophies about team sports. He does not like team sports. I'm a person who believes that if you aren't involved in team sports from a young age, that you lose a ton of social skill building. I think team sports teaches people how to interact with one another, what it means to encourage one another, what it means to compete fairly and ethically with one another. And I think it teaches you how to be a family. Yeah. No team that I ever belonged to did I not feel like those people were my brothers and sisters, every one of them. And so I am a big proponent of getting your kids into team sports. I think it makes a huge difference in your life. It teaches you how to deal with adversity. It teaches you when you need to fall back and have somebody help you. It teaches you how to stand up and be a leader. And I think it's super important. And in this political climate, we're talking about defunding education and cutting back on funding for schools.
Don't forget the arts.
Schools and the arts. And if we lose team sports, you're going to see a bunch of kids that come out of school that can't deal with working with other people. Yeah. I don't want to manage those people as a boss or in a corporation. I want to manage people that know how to get along with one another. I want to manage people that know how to be leaders. I want to know, I want kids to participate in sports. I think it's so healthy, so healthy. And I'm a huge proponent of team sports.
Yeah. A couple of seasons ago, we covered high school football games here on the radio, and it was a blast. We had so much fun. And really, we have 3 high school teams here, and none of them had a particularly good year.
Yeah.
And that really just was beside the point. And it occurred to me, you talk about team building and you talk about values. And it occurred to me that nearly everything that happened in some way or another had to do with values, had to do with teaching and affirming our ideas about fairness, our ideas about teamwork, our ideas about the role of the individual and how that fits in with the role of the team. And probably, at a higher level where there's a lot more money at stake, where it's a college or a professional team, maybe you wouldn't see that as much. You'd see a lot more kind of a cutthroat, what's the term? You know what I'm getting for,
I know what
right?
you're talking about.
Mercenary sort of approach, right?
I agree. And I see a lot of, during football season, I love pro football. Mm-hmm. I am a huge Green Bay Packers fan. And, you see a lot of people showboating. Yeah. You see the guys that score the touchdown and they dance around. And, I don't mind that. Celebrating is great. I think you should always celebrate things. But the thing I love is when the guys are all in the end zone together. Mm-hmm. Because that running back or that receiver did not get into that end zone by himself. And that kind of stuff is what carries you through your entire life. Whether you're a professional football player or you're like somebody like me or you that just likes to participate in sports on the weekends, you got to have that background. You got to learn to do that stuff.
Not long ago, I was listening to it. It was a TED Talk. I'll just confess, I was listening to a TED Talk. Don't judge. And there was a guy who was talking about a read-only culture versus a read-write culture. And essentially what he was saying was, talking about media, talking about music. And before recorded music was prevalent, houses had pianos and everybody played. And then recorded music became prevalent and fewer people played because you could just turn on the dial or put on a record, that sort of thing. And his observation was that with the prevalence of, it's become a lot less expensive to film, to make your own videos, to make your own recordings, sound recordings, that sort of stuff. He feels that we're shifting back to a culture where we do more of the creating for ourselves. And I'm getting to that. I'm saying that because what I feel like is, your argument that we're all athletes in one way or another, I feel like that fits. And I know that there was a time when women didn't take part in sports very, very much, and that wasn't all that long ago. My mom's time, they had girls could play volleyball maybe, and maybe not, right? And now girls' sports and professional women's sports, those have really taken off around the world. And those of us who are weekend warriors there are a lot more of us, I think, out there biking, out there swimming and running and trying these crazy endurance races.
Right. Yeah, I agree. Some of the best times I've had in the last few years as a new person coming to different places. I went to Cheyenne, Wyoming and worked there for a while. And I met these gals that were mountain bikers, and I had tried some mountain biking in the past with sort of semi-disastrous results. And so I sort of swore off of it. And then when we moved to Wyoming, I thought, well, maybe I'll try it again because these gals from the hospital are just like egging me on constantly, driving me nuts about going out and mountain biking with them. So I thought, well, I'll do it. And I'm telling you, these gals were just so supportive and so encouraging. And I thought, if this could just be how women treat each other all of the time, we would run the world. Because, right. Honestly, we were competitive in the sense that we were each one trying to do our best and get better for ourselves. But there was always those 6 other girls behind me saying, you can get up that rock, or you can get over that ditch. Or I was saying to them, you can go faster around that corner. Yeah. And we worked together to do that kind of stuff. And now I'm mountain biking all the time. I've been mountain biking racing now. So now It's my big thing. Now I'm mountain bike racing. Yeah.
That's crazy. Yeah. That's awesome. Yeah. And scary too.
I love it. It's great. So I've started, finding gals around town here that want a mountain bike. So I joke with, as a matter of fact, this is kind of funny. Yesterday, one of the gals I work with, her name is Mandy Fila, and she's a nurse practitioner for
Mandy.
Dr. Knievel.
Yep.
So yesterday, her kids were in the office, and I'm not a parent, so I sometimes forget that kids don't sort of get my humor. So her kids were here the other day in the afternoon, and I said to them, we were talking, how you guys doing? What's up? What's new? And I said, so I just wanted to let you guys know that I've been trying to kill your mom on the mountain bike, and it's going well. They had the most horrified look on their faces. Like, now I'm sort of developing another little group here of girls to go mountain biking with, to get out there and share that, because it's so awesome to be out in the weather here and to do something it's just so life affirming. Yeah. We were saying after we were done riding the other day that if we could just give mountain bikes to people in Chicago, I'm fairly certain that they would all stop trying to kill each other.
Crime would just cease and desist.
Yeah. You can't shoot at someone when you're trying to concentrate on going over a big rock. It's just, or getting down, or trying to get down that trail without running into a cholla.
And I'm from the cold Northeast, and a big part of why I'm out in the Southwest is all the stuff you're mentioning. It is sunlight and exercise. It is our amazing, beautiful geography out here, the topography, the challenging hills and mountains, and you can get out and exercise and ride and run every single day here if you want to.
Yeah,
a cold day for us is 48 degrees.
Yeah. I'm not necessarily one of those people that is so hardcore that I'm going to go out when it's raining and 25 degrees outside, but you can, you could here. Yeah. Whereas, other places where they're buried in snow, we're still able to hit the trails.
That's
so
right.
It's great.
Dr. Auer, you were a little reluctant to do this show.
Yeah.
You were a little spooked when you saw the microphones, and it wasn't so bad, was it?
No, it's not so bad.
It was kind of fun,
it's not horrible.
right? You forget about this after a little while,
right.
the whole... Yeah. It was a fast half hour. Will you come back and talk to me again sometime?
Sure.
That's Dr. Kathern Auer of the SSI Clinic here at KRMC. Dr. Auer, thank you so much.
Thank you for having me. It was fun.
And if you'd like to schedule an appointment with Dr. Auer, you can call 928-263-3516. That's 263-3516. And that's the show. That is Focus on Your Health. I'm TG LaFredo. Thanks so much for listening. If you'd like to get in touch with me, you can send me an email at foyhradio@gmail.com. That's Focus on Your Health, foyhradio@gmail.com. We'll catch you next week.
A, B, C, D, E, F, G, H, I, J, K, L, M, N, O, P.
Do you know the rest of that one?
Yeah, I do.